afternoon and thanks for joining us. I'm Judy Simpson. For more than a century, the Visiting Nurse Association has pioneered home-based care. Through epidemics and world wars, and with each passing decade, the VNA has become a critical resource for providing home and health services to the people and communities it serves. In Vermont, what started as a small group of nurses caring for the sick in their homes in Burlington in 1906 is now Vermont's largest home health and hospice agency. The VNA of Chittenden and Grand Isle counties is the oldest in the state. It employs 300 nurses and therapists and 225 personal caregivers who travel over 1 million miles each year to provide medically complex care to Vermonters. Today we're going to learn more about the history of the VNA and get an update on what's happening at today's VNA. I want to welcome the President and CEO of the VNA of Chittenden and Grand Isle counties, Judy Peterson, and alongside President Peterson is Heather Marquardt. Heather is a VNA community health nurse. Thanks so much for coming in today.
Thank you for having us.
Now, Judy, the VNA started in Vermont 110 years ago. What was the mission back then, and how does that compare to today?
Originally, the VNA started doing maternal child health services and really trying to reduce infant mortality. And so it was essentially a public health service in the very beginning. The VNA grew from that. The nurses worked very closely with local physicians, and then it was much later. It was in 1966 that Medicare began paying for home health services, and that's when things really were able to expand. And so nowadays we see up to like almost 8,000 people a year. And much of that is reimbursed by Medicare, but also Medicaid, commercial insurances, and of course the VNA provides services to people even if they don't have insurance, if they need it.
And here's some great pictures of the early days.
Yes, some of our history, many of these go back to the 1950s. Yes, they are the way nurses used to get around.
That's right.
At least some of them at some points, yeah.
And so, Heather, what services does today's home health encompass?
Well, we don't ride bikes anymore, but we do provide some medically complex care in the home. So a typical patient that we would see would be somebody returning home from the hospital or rehab, along with nursing services, depending on their needs. We would offer them physical therapy, occupational therapy, speech-language therapy, as well as LNA services for personal care. We also have a telehealth service that helps us track our patients' vital signs on a daily basis.
Tell us how that works.
So the patients themselves can take their vital signs and they automatically get sent to our office where our telehealth staff monitors those vital signs, and if they find anything off, they'll call the patient and see what's going on. They also look for trends and they coordinate care with the doctors.
Yeah, and if I can interrupt, Heather, they're great. They look like little iPads that sit on somebody's kitchen table or their bedside table, and it automatically at a certain time in the morning says, "Good morning, it's time to take your vital signs." And the patient's able to do it themselves. And we have one nurse at the VNA who's able to manage 100 telemonitors that we have. And so as each person does their vital signs, the information comes in, that central station telemonitor nurse can see if that person's vital signs are coming in within their parameters or not. And so if there's something that's out of the range of where it should be, then she can call the physician, she can call the patient, and really manages it.
That's incredible.
One of the biggest things that my patients have found very valuable with the VNA has been we are there 24/7, every day of the year, holidays at 3 o'clock in the morning. They can call us, and that really gives them peace of mind.
I would imagine so. Now, you also do palliative care as well?
Yep, palliative care and hospice in the home or at our respite house. So.
And so, Judy, how long have you worked in home health, and what attracted you to this area?
Oh, I've been a nurse for a long, long time, and I've been in home care really since about 1977, so it's been almost 40 years.
And how about you, Heather?
I'm originally from Wisconsin, where I worked in an ICU in Milwaukee. When I came here, I wanted to do something different. I have 3 school-aged children, so I thought home health would be a great fit. And the VNA has has proven that. I'm able to stay at home with them in the morning and see them off to school, and I'm usually home by the time they get home from school, and they do their homework and I do my charting, and it really works out very well. But I have found it to be extremely rewarding. My favorite nursing job ever. Getting to know the patients on a personal level and their families has been very rewarding.
And Judy, maybe you can talk a little bit about how important it is to have folks at home. I mean, everybody wants to get out of the hospital.
Exactly. And you know, people will anecdotally tell you, and actual research shows that when people are home, they heal faster, they're more comfortable, you know, they're able to sleep in their own bed, eat their own food, they can have their dog or their cat with them. And nowadays, we can provide a very high level of service. You heard Heather talk about some of the services that we provide. It's really complex care. There are things that we do at home now that not that many years ago used to be done only in an intensive care unit. But we do have people home who are on ventilators, who require very complex wound management, who, geez, what, you know, all kinds of things that...
IV antibiotics.
Yes, different infusions. And as you know, we provide services through the whole range of the lifespan. So it's from the maternal child services, as we saw in some of the photos, the roots of the VNA, all the way through to the acute care and post-acute care that Heather was talking about, to end of life, including hospice services at our new respite house in Colchester.
Are people surprised to find out they can get this kind of care at home?
I think they are. I think when nowadays hospitalizations are much shorter than they ever were before. And I think sometimes patients are surprised when their physicians or nurses or discharge planners in the hospital say to them, "So you're going home tomorrow?" And they say, "Wait, I just had surgery yesterday." But when they're told that the VNA will support them and they get home and see that staff come in and there's just such a wide range of both the medical care and supportive services that we're able to provide to people, they're thrilled.
So Heather, do you think that people are surprised to learn about the VNA?
I think so. I think that there's, you know, a lot of people do know about the VNA, but I think there's work to be done as far as getting the word out there that we can, the services that we provide and how helpful they are. And I think that if we work together, you know, that we can, by word of mouth as well, we can get the word out.
And it really is wonderful that, especially now in these days of healthcare reform, there's a lot of collaboration and integration going on now between the hospitals. We've always worked well with the hospitals, not just UVM Medical Center, but other hospitals that refer to us. But now it's even more integrated, the care, because we know that we want to avoid somebody having to be re-hospitalized. Right. And that requires great discharge planning. And also all of our other community partners like Howard Center providing mental health services, the Council on Aging, the SASH program, all of these providers, now we really communicate with each other so much because we know it takes a lot of services to help somebody stay home.
Let's talk a little bit about the numbers. You're one of the largest employers in Chittenden County.
Yes, we are. We have about 640 employees. Yeah.
And just last year, our staff made over 80,000
Wow.
visits.
Yeah.
And we've helped over 7,600 people in just that year.
Yeah.
Talk a little bit about the Adult Day program. What's that all about?
Adult Day is a really fabulous program. We have 3 Adult Day centers, and 2 of them provide memory care. So that's for people who may have some kind of dementia, such as Alzheimer's. And it's very rich programming. Nowadays, as you know, many families, both the mother and the father, the husband and the wife work, or whatever the family constellation, they're working. If they have an elder living with them, sometimes it's very hard to be able to work and still care for that person. People can come, the elder, the frail elder, or somebody with a disability is able to come to one of our Adult Day centers and spend the day there and really do, have great food, have nursing care we provide there also, but really rich programming. They grow gardens in the summer. They go to the Champlain Valley Fair. They do their own news programs. They write books together. I mean, it's just really fabulous what goes on at those adult day centers.
They sound like they're pretty popular.
They really are. And we, last year, just about a year ago, we opened a new center in Essex, and that's been doing very, very well. Yeah.
Now, you also provide private care services?
Right. Our private care is those for people that might need just a little bit extra help with maybe some housekeeping or personal care, maybe some med management. So.
And so where is home health going in the future, Judy, do you think?
As I mentioned before, that Vermont, especially the nation, but Vermont especially, is in a era of healthcare reform. So what we're all trying to do is meet what's called the triple aim, which is to provide better quality care, to do it at lower cost, and to do it with high client patient satisfaction. The VNA really adds that value because we do provide care for people in the setting that they want to be, which is home, very high quality, and we're much less expensive than being in an inpatient facility. So home care, it's really wonderful. As I mentioned, we've been integrating with all these other providers, and the value of home care is really being recognized now here in Vermont and also nationally, that everyone recognizes that where people want to be is at home, and that's where you can provide really high quality care and not get as many infections and not have some of the anxiety, and it's really a.
And it's also to the ability to personalize the care.
Yes. Yeah.
Yeah, I feel that one of the a huge benefit is when people are coming home from a hospital or a rehab center. Sometimes that can be a very stressful situation. So making that transition home, getting their meds organized, making sure that their surroundings are safe is a big key in avoiding rehospitalization.
Yeah, I would imagine it's a little overwhelming to all of a sudden to be back home and have to think about everything that you've been through and then have to organize what's the next step.
Right. And there are certain questions that just don't occur to you while you're still in the hospital. And then you get home and you realize, oh my gosh, I'm not sure how to do this or what to do about this. And that's what's so wonderful about the VNA having that 24/7 availability also, because sometimes all clients, they may have had a nurse visiting them in the home, but then in between visits, they just need some telephone reassurance. They need someone they can call to say, is this okay? This is what's happening. So we're able to provide that.
Are people surprised that there is this depth of care available?
I think so. I honestly don't think most people realize how large the VNA is or what a large volume of service that we provide to people. And also the depth and breadth from prenatal through end of life.
And so how can viewers learn more about the VNA for themselves or a loved one? What should they do?
If they would like to receive VNA services, they can talk to their physician, but they're also able just to call the VNA, and our phone number is 658-1900, 1900. We also have a website, which is www.vnacares.org. So any of those vehicles a person can use. And if somebody calls in, we'll help them just think through what it is they need. And if the VNA isn't able to meet their particular need, we know what other community resources might be able to.
Because it could just be a simple, filling a gap.
Exactly. Yes. Yeah. And as I said, we really want to collaborate with our community partners, and we know that if there's something that we're not able to do for somebody, there's somebody else who probably can, and we all work together to refer back and forth like that.
And even if it's a family member that may have expressed a concern to you, it's a good idea to call and just find out what's available.
Absolutely. And our community supports us so much. The VNA really benefits from donations from our community, and that's what allows us to do all of this work for people, whether or not they have insurance. So we just can't thank our community enough.
I want to thank you for joining us today and talking about this.
Thank you.
That's our program for today. I'm Judy Simpson. I'll see you again next time on Across the Fence.